Welcome. In the previous lecture, we have talked about various lifestyle diseases. Under these, cardiovascular diseases are really important. When we talk about cardiovascular diseases, these could be of various types. We would be focusing on 11 major cardiovascular diseases today. So the first is coronary artery disease. Now, coronary artery is deposition of plaque within the arteries. So when the cholesterol level, the low cholesterol levels are high in the body, what would happen? There is thickening of the arteries and deposition of this plaque in the arteries, which actually, let's say this is the artery, and once you have the cholesterol layer which is deposited, this artery thickens, so the blood volume that would be has to flow with more pressure. Now this causes coronary artery disease. So symptoms include chest pain, which is also known as angina pectoris, breathlessness, fatigue, pain which radiates from arms, neck and the jaw, right? So we call it as coronary artery disease. The next is heart attack, which is known as myocardial infarction. Myocardial infarction is basically the blockage in the artery that could occur because of this plaque deposition or the coronary artery disease, and therefore the blood supply is not able to go to the other part of the body. So this causes severe chest pain, sudden collapse, sweating, nausea could be some of the symptoms. The next is stroke. Now, stroke is a blood clot that occurs all of the sudden. This clot could be in the brain, it could be in any other vessel which interrupts the flow of blood. So, this is a clot which interrupts the flow of blood. And the symptoms would include weakness, numbness, dizziness. Sometimes there is facial drooping, vision disorders that could be seen. Heart failure. Now the heart muscles get weakened and they cannot pump the blood properly. As a result, there is fatigue, breathlessness, signs of swollen ankle, all of the sudden gain in the weight, a persistent cough that could be seen. Arrhythmia is irregular heartbeat. Now, irregular heartbeat is because of the abnormal electric signals which are generated and they disrupt the rhythm. Now, this arrhythmia could lead to or could actually be visualized through palpitations, dizziness, tightness in the chest, all of the sudden fatigue that could occur. High blood pressure or hypertension can lead to coronary artery disease, and this is one of the lifestyle related problems. Now, the symptoms include heart attack, stroke, coronary artery disease, which is known as CAD also, arteriosclerosis. Now, arteriosclerosis is deposition of plaque in the walls, and this leads to hardening of the arteries. Now, once there is hardening of the arteries, this is one of the problems with no